Here's what I feel about this. Now, the vaccines are effective, but in those who are immunocompromised, sometimes we have seen that the antibody levels tend to drop off. Especially, we have seen this in transplant patients who have received a kidney transplant or a liver transplant or a heart transplant. And so for somebody who's immunocompromised, and since the CDC has not come up with their recommendations for a booster shot yet, I think if you feel comfortable wearing a mask, especially when you go into a crowded place, I think that's very reasonable. And I think anybody who wants to protect themselves, I think they should do that. And I support what you're trying to do. What do you think, Dr. Haddadin?
Yeah, I think that is very reasonable, actually, at still undefined, really, end to this problem. And I think each one should really try to still stick with the distance, masking, and try to do hand hygiene and ventilation, all of these things. And it's really very important that, when you go out, since you don't know who's around you, to try to use a mask. I would suggest this is especially for, older population and so on. I think I would still continue to use it until we get out of this to a level that where everybody is really is protected. And the same thing applies really for school and so on. So imagine that you have a less than 12-year-old going to school and the household is not vaccinated. And now we don't have anything to control the kids in the school, and they go back to their parents or grandparents. And now, oops, somebody else got sick where they went to school and they got it. The kids, they don't feel it much. They get it and they hug their beloved ones at home, and the next thing they get it. So I think everybody should really weigh on masking and unmasking based on their contact with other people around them, and then try really to use that as a way to gauge to stay with mask or not. Myself, I still would say with the Delta variant and maybe others to come, probably keep careful until we get out of this altogether. That's what I would say.